Welcome, valued listeners. So happy that you're joining me today. My name is Denise Mayer, and I am the founder and the director of Step Up Anderson Township, which is a coalition for a safe, healthy, and drug-free community. We started this about 6 years ago to be able to reach parents and caregivers with information that is just vital for them in raising healthy children. So we are starting this podcast to try to reach you where you are. So instead of asking you to come to presentations, we're trying to reach out where you can look at this at home and put in a load of wash in between, or you can listen on Spotify while you're picking up your child from football, etc. So we are very excited to start this, and this is our second episode. So this is to talk about marijuana and all the hidden risks that come along with it for our children. So my guest is Alicia Currie, who is with Children's Hospital. She is the operations manager for the Cincinnati Drug and Poison Information Center. It's a division of Cincinnati Children's, like I said, and Ms. Currie has over 27 years of experience in drug information, overdose, substance use outreach, and prevention, teaching, research, and leadership. Ms. Currie has supported DPIC in a variety of administrative and clinical roles. Ms. Currie obtained her Bachelor of Science in Nursing at the University of Cincinnati, a Master of Science in Nursing Education at Indiana Wesleyan University, and is professionally certified in toxicology and prevention. In addition, Ms. Currie holds an adjunct faculty position with the University of Cincinnati's College of Nursing. Welcome, Alicia.
Thank you so much, Denise. I'm very happy to be here to talk about marijuana and the hidden risks and trends, and doing basically some things that we can do about harm reduction with this topic. So thank you so much.
Well, so we're so excited to have you, because this, with the legalization and everything, there's just so many questions about what this contains, what it looks like. And I know for a fact that the poison control has morphed or evolved, or whatever you want to call it. So maybe you could address that. I remember myself as a mother that I had that number, it was a phone number back then, on my medicine cabinet door, and I used it quite a few times when the kids got into something they shouldn't have. So if you want to start with that, and then let's go.
Yeah, absolutely. So just a little bit about the Drug and Poison Information Center. So we are a 24/7, 365 operation. We're always open. Our service is free, it's confidential, and it's available to anybody. Some people, might think of poison control as, maybe the traditional, like, your 2-year-old gets into bleach, or, 3-year-old gets into amoxicillin, and we do take those types of calls. But we really actually take calls on anybody. So it's, even though we're part of Children's Hospital, it's really anyone can call us, any age, about any situation. It could be a snake bite, it could be a bee sting, it could be eating a berry in the backyard, or it could be getting into something like marijuana edibles, which is what we're talking about today. So service is always there.
Service. I mean, just saying, what a great service. Think of that. I mean, it's amazing. It's like having your own support team behind you. So
yeah, exactly. And we are staffed by nurses and pharmacists and physicians and allied health specialists, mostly paramedics. And so our staff is highly trained in toxicology, and are always available to help with any of the questions. The other thing is that you can actually call, and even if you just have a question, so somebody doesn't have to have an overdose or be exposed to something, you can call us, because part of our mission is also prevention, and preventing poisonings if possible.
All right. Well, I guess let's get going, because there's so much to talk about.
Right. So Let me go ahead and I know we're going to talk about a few things, kind of throughout this hour. And some of this stuff, like if you're actually viewing it online, you might be able to see some of the images and stuff. But for those that are listening just with audio, I'll try to explain a little bit of what some of you might be seeing if you're actually viewing it. And kind of one of those things is like, well, we're going to talk about marijuana, and one of the things that I think is important is to understand the that marijuana it's a complex plant. It has lots of different chemicals in it. Mostly what we're talking about today is going to be that THC component, the tetrahydrocannabinol component, which is that component that's really the psychoactive component of the plant. We also, I'm sure people have probably heard of CBD as well, is also very common now in a lot of products. CBD generally is less concerning when a child or anyone gets into it or takes it. So really kind of focusing on that THC today, and particularly the edibles. I think the other important part of this is the THC, in the typical sense of what people think of as THC, it's usually Delta 9 THC. But I don't know if you've seen products out there. Have you, like with Delta 8? Have you seen Delta 8 out there? Yeah. So a lot of those Delta 8 products and even Delta 10 products are also out there and very available now. And, just kind of knowing they are a little bit different than the traditional THC, but have similar effects. And so really when we're kind of talking about like this topic today, it's really all three of those. Mm-hmm. And, I think maybe one of the first questions might be the legalization. We know in Ohio that, we just recently legalized recreational. We legalized medical marijuana back in 2016. And for those of you that can see the screen, it's basically a map of all of the different states that have either legalized medical marijuana or recreational marijuana, and a couple of states that still haven't legalized either one. But definitely lots and lots more legalization, not just in Ohio, but across the US. And this is one of the things that is causing more of these exposures, especially in children, to these products. I think the other thing that's interesting is, just the number of dispensaries that have become available just in our area. There's multiple dispensaries in the Cincinnati area, probably upwards of 20, maybe 30. A lot of these dispensaries initially had just medical marijuana, but as of a couple of weeks ago, around September, 1st of September, mid-September, often all of them kind of started also having recreational marijuana as well. And so these are dispensaries that are in our neighborhoods, close by, and very available. I think the other part about the legalization part of it is that Ohio does have specific marijuana laws. They're similar to other states' laws. Obviously, this is still THC. Marijuana is still a federally illegal substance, so all of the laws really are with the states in terms of what they are legalizing. In terms of medical, 18 and older, so you have to be 18 years and older and go through the process of getting approved for a medical marijuana card from a licensed medical marijuana dispensary and all of those sorts of things. So medical is 18 years and older in Ohio. Recreational is different. It's 21 and over. With that, it still has some limitations in terms of how much you can possess. So for example, 2.5 ounces of cannabis or 1/2 ounce of concentrate is the limit of what someone could possess recreationally. Interestingly, part of the law is also that people can cultivate or grow their own plants at home for personal use. And so that is also in the law in terms of how many plants a household could have.
And I think we have to say, Alicia, that obviously young people can purchase this from a little bit older people, upper, like a sibling or something like that, and, grow it and whatever. And so those age things are kind of almost a joke because a lot of the kids can get these things, and we know they are.
Yeah, I would equate it to similar to alcohol, where we know that there's a good amount of underage drinking that occurs. Yeah, so technically it's whoever goes into the dispensary needs to be 21 and older.
Right.
It's my understanding that they do check for that, but of course, it could vary. And yeah, once it's out of the dispensary and in homes and other areas, it certainly becomes more available to anyone
Yeah,
of any age.
exactly.
Yeah. So I think, kind of starting with kind of the bigger picture of marijuana overall and that sort of thing. And then really kind of talking a bit more about edibles, because I think the THC edibles in particular are the types of exposures that we are seeing a significant increase in, both in young children and by young children, 0 to 5 years of age. And then also in our teenage populations, 13 to 19 years old. We are seeing it in the in between, 6 to 12-year-olds as well, but a little less. But it's definitely something that is a topic that is right on the forefront of what we're thinking about as poison specialists and in toxicology, because we're just seeing a lot more of these cases and situations. One of the things that I think is concerning is, I think overall, people think of marijuana and they might think of marijuana that was around 10 years ago, 20 years ago, 30 years ago, 40 years ago, in this type of marijuana that's out and available now, particularly in edible form, is just totally different. It's much more potent. I'll kind of explain a little bit more about like serving size, because if you're thinking about an edible, it's not a joint, it's it's a gummy or cookies or a brownie. I think the other part about edibles that is very different from smoking, so in other words, you eat the edible versus smoking a joint or something like that with THC, is the edibles are metabolized very differently in the body compared to smoking. And so usually when someone smokes marijuana or THC, they will have the effects within about 15 minutes. Like it's pretty quick. When you smoke something, the absorption through the lung is very, very fast. It gets distributed to every tissue in the body, brain, organ, all the different organs and things, and you feel the effects pretty quickly. But with edibles, when you're eating something, it's that absorption in the stomach is different. And that's one of the reasons why sometimes even people that might have some experience with THC, and they may not know about the edibles and the differences. And in those situations, sometimes they can end up taking too much because you really don't see the effects for about an hour and a half after you eat an edible. And of course, there could be some variation in things with people and the products and things, but there really is a delay with that oral, or in swallowing cannabis to where you might take some, somebody might not have the effects or feel the effects, and then, say, maybe this was a dud, maybe it wasn't that, that strong,
Right.
eat more.
I think one funny thing, to interrupt, I'm sorry, is that the suggested amount on a gummy bear, and we all know how little a gummy bear is out in Colorado, you would eat the arm off of the gummy bear. That's the suggested amount. That's hilarious. I mean, what child is going to eat the arm off of the bear? They're going to eat the whole thing and then more.
It's so true. And that is also part of the education that we're trying to get out to everybody is just understanding these products, because they're just so different. You're absolutely right. Like a piece of candy, or and maybe a serving size might be an eighth of a cookie. Like, I don't know about you, but most people probably aren't going to eat an eighth of a cookie.
No.
And stuff. So it is definitely one of those things that makes it difficult and easy to overconsume or even overdose on these types of products because of how different they are. And I think, in terms of edibles, like you kind of bringing up gummies, there's definitely gummies, there's chocolates, baked goods. So, you're kind of maybe what somebody might think of traditionally as an edible, might be like a brownie,
Mhm.
cookie. It's also, there are THC beverages available now. But ultimately, these basically look like real food. That's kind of one of the biggest concerns about these types of products. And in terms of the packaging with it, so the one thing that I will say is medical marijuana is different than recreational marijuana. So Ohio does have packaging requirements for medical marijuana. The marijuana is regulated by the State Board of Pharmacy in Ohio. And so there are specific regulations with it has to be in child resistant packaging. It can't look like a gummy bear. Like if it's a gummy, it's a little round gummy versus like a cartoon character or something like that. So the medical marijuana, it also isn't like flashy packaging or anything like that. So medical marijuana is different. Recreational marijuana it's kind of a free for all. It could look like anything. It could be any kind of packaging. And one of the things that's really interesting is that some of these companies are producing products that look exactly like another product. So like for example, like the trolley gummy candy that's very common, for kids to eat, for adults to eat. There's some marijuana products out there that look exactly like that. And unless you know what to look for on a label, you may not know that something like that has THC in it. And along with sort of the lookalikes is that we kind of mentioned this before, but they're highly potent. It's not a small amount of marijuana that's in these products. So that's definitely one of the concerns that we have in terms of a safety perspective of
Right.
trying to do something about these lookalike products. And some of if you're viewing this online, you can kind of see some examples there. But just to kind of explain a little bit, there's Sour Patch Kids, container or packaging, and the one is the traditional packaging, and another one says Stony Patch, but it has the same coloring, similar characters and things like that as to what the Sour Patch Kids product would have. That one is probably the one that might be the most obvious because it does actually have marijuana leaves on the packaging as well.
Yeah, maybe.
Yeah, maybe if you're
Maybe, right.
attention. But some of these other packaging are quite similar. And certainly, especially if someone is not storing these products like medicine, but storing them like food, that's where we get concerned about those unintentional or accidental types of exposures to these products.
Well, and the main products, the real products that are candy, are continually changing. Think how many times you go in and you look at Skittles and now they've got a new flavor combo or whatever. It makes it very confusing for people to know.
It definitely does. And yeah, actually I had an example of like these zombie Skittles, which are actually a legitimate product.
Yeah.
They come out at Halloween time
Right.
for the company that manufactures them, and they're, yeah, they look different, but they're actually a normal product. And
Right.
so, yeah, some of the things in terms of like, how do you know what is a THC product, containing product versus not, is one of the things that's also really important. I do have some people ask me, how can this happen? Like, how are people allowed? Like, are these the companies
Right.
themselves that are creating these? And no, it's not the Jolly Rancher company or the trolley company that's producing these. It's these sort of basically these marijuana companies that are producing these products and intentionally making them look like a regular product. People also ask sometimes, like, how can that be the case? Aren't the companies going after them, or is somebody trying to shut them down? And the Federal Trade Commission and the FDA have sent cease and desist letters to many of these companies that are producing these products, and really because they're selling these products in packages that are designed to look like kids' snacks, and that's just inherently a huge problem. I kind of saw those. I researched that to see, like, what has been done, or what company, because it's not really necessarily the FDA, because these are not federally, controlled products at
Right,
the
right.
state level. So it is a little bit tricky, but the FDA did partner with the FTC, the Federal Trade Commission, to kind of get these letters out. But I was kind of curious. I did look a couple days ago to see, like, can I get a Nerds Rope THC product online? And yeah, I definitely can. So I just kind of brought that up and just Googled it to see if it was available. And there was one that was available for $25 online. So they're definitely, still available. I think sometimes the other question that comes up is, where are these products being sold? And no, they're not in Kroger or, Walmart or wherever, you get your
Right.
groceries. But they're either online or in these dispensaries that I
Yeah.
mentioned are where some of these products could be. I did also notice I just happened to be door dashing dinner for my family one night, and I realized you can actually DoorDash THC as well. Um,
That's unbelievable. I mean, that really is unbelievable.
I know. I was like, you've got to be kidding me. I'm like, well, I guess I should add that to the list of places, where things can be available. I don't know in terms of like, how do they check for age and how do they, but the DoorDash situation, I mean, if you had a young child that couldn't drive, but, wanted to get a THC product, I mean,
Mhm.
theoretically they should be checking age. But, it's so hard to know how that
Right.
goes all of the time, depending on
Yeah.
where they're getting it. But yes, they're available. They are.
Unreal. Mhm.
Yeah. And I think, so one of the things is, well, how do I know? And on some of the pictures that were shown in the packaging, it was a little bit hard to tell because they were smaller pictures, but the THC products should have some kind of marking on them. And most of the time, the marking is either a marijuana leaf or, like in a triangle shape, or it might say THC in bold letters in a triangle shape. So most of the recreational products have something like that. The California one is a marijuana leaf in a triangle, and then it says CA below it for
Right.
California.
See it. Mhm.
Yeah. The only thing that we know right now in terms for Ohio is that the medical products, and again, the medical is different because they're not in
Mhm.
these like packaging, but the medical products have to have that state of Ohio Board of Pharmacy seal on them. And otherwise, the recreational products for Ohio, that's all still being worked out. So in terms of one of the things that we're trying to do is advocate for that safe packaging, with the child resistant packaging, safe storage, and all those sorts of things. But that is all kind of still being worked out for Ohio. So we don't yet know what that requirement will be in terms of labeling at this
And we
point.
know that all moves slowly. All of these things move slowly. So
It
in
does.
between, it's on us to, at least let
Exactly.
everyone know. Right.
Yeah, I mean, really have no idea when all of that is going to actually be finalized and come out. Heading into a holiday season, it's probably going to be a while. Would be my guess, but yeah,
I guess too.
it's still, yeah, definitely unknown. And I think part of these other, lookalike products is really just the tremendous amount of THC that's in these products. And one example is like the Nerds rope. I don't know if the listeners are familiar with that, but it's just like this long like rope of Nerds candy, and there is a lookalike THC product out there, and in that one Nerds rope, there's 400 milligrams of THC in that one Nerds rope, and in terms of like so what does that mean, like for people that maybe haven't used THC or aren't sure, a low dose, a starting dose or microdose might be like 2.5 to 5 milligrams for someone, and then it kind of goes up to maybe 10 milligrams, maybe 20, maybe 30, maybe 40 for like as people kind of progress along,
Mhm.
and 100 milligrams would be a lot, and this one rope has 400
Right.
in it. And so I think that's the other thing. And also what we're seeing in our exposures and our cases is that because it just takes such a tiny amount to be a problem, that's where we're starting to see a lot more kids and adults that are getting too much of this, and certainly having adverse effects from it.
Yeah, serious adverse effects.
And
Yeah.
I think even if you know that the product, like even if you can look and see, oh, this product it says THC on it, or it has a marijuana leaf on it, or one of those logos. Once the product's out of the packaging, it's virtually impossible to tell the
Right.
difference. So I think that's the other added
Mhm.
layer of concern with some of these things, is
Right.
that really even more unknowns. The one thing that I will say is that I mentioned before that like the Doritos company and the Frito-Lay company or whatever, they're not actually producing these products. It's
No.
other companies making them look like it. There are a couple of exceptions, and one is I mentioned earlier those THC infused beverages.
Mhm.
So there, for example, the Pabst Blue Ribbon company actually is producing a seltzer
Mhm.
that does contain THC, and they're marketing it as what they call a different kind of buzz, and all kinds of other things. And that one, I believe, is 10 milligrams in that one. Yeah, so each 12-ounce can has 10 milligrams. So fortunately, it is a lower milligram, but if you think about, how many drinks would one consume, it could be multiple, and not just one. So that is one sort of exception of the actual company is producing some of those things. And I think, kind of going along with these products is also sort of understanding what does it mean, like some of the terms. So what does potency mean? What is the dose, and what is the serving size? And all of those are slightly different. And so when you think about potency is typically in a percentage.
Mhm.
So it's the product weight is THC is, say 20% or something like that. The dose is usually in milligrams. So it'll say how many milligrams. So I mentioned that Nerd Syrup was 400 milligrams of THC. And then we kind of talked about the serving size, where the serving size, it often, these products are not single servings. They're often
Mhm.
multiple servings, even in one cookie or one chocolate bar or something like that. And so in theory, these products should have the potency, the dose, the serving size on the label. But again, it's recreational. It's often difficult to know, is that really what's in it? And sometimes it's also difficult to find the information in some cases. Um,
But even if they do read it, let's just go with best case scenario. Half of the time, it's like us eating something, and it's got a lot of calories in it, but I'm going to eat it anyway. So I think that that's kind of what happens here. They don't read it, they don't understand. And for a point of reference, back to what you were saying earlier, back in Woodstock, a joint was 2 to 3 to 5% THC, and it was half of that was burned up in combustion. Now this stuff is so high, and the oil that is produced when they do all that can be put in anything. I mean, you can have regular popcorn, regular anything, and if it's sprinkled with the oil, it's like the Wild West. You have no idea what is all in there.
yeah, and I know that there have been at least a couple of things that I've seen in the in the news, and I'm not sure where it was, or how long ago it was, but even THC spiked parties, or like I think there was a wedding reception for somebody where they had THC infused food, and the guests didn't know, and it's certainly a problem, right? Like
A
that's
big problem.
big problem. And not to say that happens all the time, or it's, you have to be constantly worried about it, but you're right. I mean, there are, if you have the THC product,
Mhm.
yeah, it can be added to a variety of things, whether it's by a company that's doing it and manufacturing it and sort
Right.
of packaging, or somebody that just buys the tinctures or oils or whatever,
Mhm.
and has
Right.
them available. Yeah, so I think it's definitely one of those things to be aware of. And And I think the other part of this is well, what happens when somebody gets into it? Like, is it really that bad? And I think, like you were talking about, in the Woodstock era, or years ago, I think a lot of people are thinking that that's what marijuana still is. And
Oh,
it's
yeah.
so different now. And we definitely know that with increased access, being more available, we definitely are seeing it, at least, in poison control and in the toxicology world with these. And I can kind of tell you about one case that we got. It was the mom of a 2-year-old who, in this situation, it was Delta 8 THC gummies. And each of those gummies, one gummy had 40 milligrams of THC. And the child had gotten into the gummy a couple of hours ago, I think 2 hours prior. And the child called it candy, and he was eating them when mom found him. And it's really hard sometimes to know how many are missing. It's even hard with prescription medicine and
Sure.
over-the-counter medicine. Yeah, sometimes it's, that's one of the things our specialists do, is try to kind of narrow things down. And in these products, sometimes it's even harder because they may or may not say, how many are in the product or in the packaging. But it was thought that he may have eaten anywhere from 10 to 40 gummies. And again, each of these gummies was 40 milligrams. And he did end up vomiting right away. And mom kind of watched him and waited a little bit. And then after about 2 hours, he started getting really, really tired and sleepy, started stumbling around. These are fairly classic symptoms that we typically see. And so mom called us at that point, and she's like, very worried, and, was wondering what to do. And based on that amount, and the child having those symptoms, we did recommend that she go ahead and take him into the hospital. In the hospital, he started vomiting more. He became completely unarousable. They couldn't wake him up. And his respiratory rate, or his breathing rate, slowed down. And so at that point, they were concerned with that kind of combination of being unarousable, or not waking up, and the breathing slowing down. So they ended up putting down a breathing tube. They intubated him, and he ended up going to ICU. Fortunately, he did well in ICU. He responded well to those treatments and that supportive care that they provided for him. And he ended up being discharged home a couple days later.
I
But
think that's a good point, though, Alicia, that you said about the supportive care. I think some people think, oh, if you just do too much of this, there's a magic pill that they can give you and you snap right back out of it. That's not the case, right?
right, yeah. So
Mhm.
I think a lot of times in toxicology and in poison control, there are a lot of products that have an antidote that
Right,
reverse the drug or the product, but many more things that don't have an antidote
right.
or specific reversal.
Mhm.
And THC is one of those. So there's not an antidote specifically that reverses it. And yeah, typically with those scenarios, it's really providing really good supportive care for the symptoms that they are having at the time.
Mhm.
And in this situation, the child was very sleepy, and mostly they were concerned about his breathing,
Sure.
because he's getting so sleepy that it was
Mhm.
affecting how many times a minute he was breathing. And
Yeah.
that's why they ended up intubating him, putting him on a ventilator to breathe for him, while that THC kind of got out of his system. And then once it was out of his system, he did well
Mhm.
and was able to go home. The other thing, in serious overdoses, the other things, occasionally we can see seizures with this as well. And so there are medications that can treat seizures, and in those situations, those are given to help stop those. But this is a fairly, I mean, this is one of the more serious cases.
Mhm.
I would say that, first of all, I think honestly, we're getting 1 or 2 calls a day now on marijuana
Wow.
edibles, which is a pretty big increase.
Mhm.
Most of the time, these children end up requiring care in the hospital, or that we recommend that they go into the hospital. About 8 out of 10 exposures in the little kids, in the 0 to 5 year
Mhm.
olds, we usually have to recommend to go into the hospital. And again, a lot of that is because of the potency of the products, and it just doesn't take much for them to get too much. About 6 out of 10 of those are admitted, so they end up actually going to a floor in the hospital, and about 15% are ones that actually require critical care, like the case example that I went over. Our teenagers are a little bit different. They actually are referred in even more. Like 9 out of 10 teenagers are referred into a healthcare facility, and sometimes that's because of the amounts. Like if they're intentionally using the THC, they may just be getting more of it. And usually, if they call us, they probably are having some kinds of symptoms.
Right.
One thing that I would say is, with our data, with Poison Center data, our reporting is passive, right? So people choose to call us. We get calls from the public, so from parents and people themselves, and we also get calls from healthcare providers. So like the doctors in the ED or in the ICU also call us to consult on these cases. But nobody's required to call us. So it's very likely that there's a lot more happening that we don't know about. And so that's kind of another thing. So this is kind of reflecting just our data. And I think, I kind of mentioned like overall with the landscape of more legalization and things like that, there's certainly, we're seeing it across the country. So it's a massive increase across the country with these types of products.
Well, the states that legalized this a long time ago, like Colorado, California, I mean, they've been seeing this for quite a while. We're just new to it because it only became legal, last year. And there's just so much that people don't understand about this and how serious this is. And the addiction part of it, how addicting it is for these teenagers that start doing this. It's not something they can easily turn off.
Yeah, and it is one of those things where we certainly worry a lot about the little kids. We worry about the teenagers. Certainly with children and adolescents, use of THC, it does affect the developing brain. In a lot of situations, the brain isn't fully developed until mid-20s or later sometimes. So if THC is being used, it specifically is affecting those areas of our brain where we, build connections between like thinking and memory and learning. And all of those things are incredibly important to in development and to be successful in school and in life and things like that. We also still don't fully know the long-term effects. Like, you mentioned out in Colorado, they legalized, I think in 2012. So it's been a while for them. We knew from our colleagues, our Poison Center colleagues out there that, we were going to start seeing an increase because that's certainly what they and all of the other states that have legalized before us have seen increases in these cases. So we kind of knew it was coming. But even with that amount of time, we still don't necessarily know all of the long-term effects that can be seen, which is scary. And, and I think some other vulnerable populations, certainly that children and adolescents, women, who are pregnant or breastfeeding, there's certainly some effects on the unborn baby's developing brain. We also know that people that have a co-occurring psychiatric condition, especially something like schizophrenia, using THC is really dangerous for them as well. And
the psychosis that some of these young people are, experiencing and showing that end up in the emergency room. I think that's so scary.
It is. It is. And, it's one of those things where it is an altering substance, right? It's a psychoactive substance.
Yeah.
Everybody's going to have a slightly different response to it. You might get something that's much more potent than what you're used to. It might be a situation of, eating some and then thinking it's not working and eating more. And then all of a sudden you're getting that compounded effect. Yeah. There's just so many different possibilities for concern.
Yep.
And, it's definitely something that we are trying to get the word out to kind of just so that people know. I mean, marijuana is, it's here. It's not going to go anywhere at this point, or at least for now. And so it's trying to get this information out so people are at least aware
Yep.
of what's going on.
So important.
Mm-hmm. And I kind of mentioned before, like with the Poison Center data, we do certainly the calls can be confidential. People don't have to give their name and phone number. We typically ask for zip code, and we do ask for name and phone number if they're willing to give it. Oftentimes, we'll follow up to see how the person is doing and those sorts of things. So oftentimes we also get age of the patient. And one thing that's interesting is that, THC is meant to be for adults, right? Like it's meant to be for adult use, but half of our exposures are in kids, less than 19. And so it's definitely something where it's out there and it's available to all ages. One thing that was kind of interesting is we did see a little bit of a delay in our increase in call volume when medical marijuana was approved in 2016. Part of it was that, all the infrastructure had to be set up, with the board of pharmacy and everything else. So we didn't really start seeing cases increase until about 2018, 2019. And that definitely went along with the first dispensaries opening with the medical marijuana. And that was definitely an interesting trend to see.
Well, and it's not that hard to get a medical marijuana card back in, it's not. I mean, you can say you have all kinds of anxiety so teenagers, well, I shouldn't say teenagers, but young people can easily get them with, kind of a half made up, diagnosis. And so I think that's why it took a little while for it to start. And then bam, it started to go up.
Yeah. And I think at this point, we know that basically what we've been seeing is probably related to the medical THC, the medical marijuana, and that with recreational coming on board, we're expecting to see more and more of it.
Oh, yeah.
And that's where it's like, okay, what can we do about it? Because it's here. And, I think we kind of talked a little bit about this already, but like the sort of those increased risks that are associated with both young kids and teenagers. And I think, one of the things is sort of that safe storage. And I've mentioned that a few times, but hadn't really explained it. But one of the things with that is not just storing the product out. Like if you have it, if you are someone that has it in your home, storing it up and away, out of reach, but also out of sight. Because we do know that if kids can see it, and particularly if it's a product that looks just like food or looks like a snack that they're not allowed to have or whatever, they're going to be very vigilant in trying to get to it. And so that's kind of where that safe storage messaging is really important. And I think I mentioned this earlier, but store it like you would store your blood pressure medicine or your diabetic medicine.
Yeah, any medication that could be gotten into, right?
Yes, not like it's a candy or like it's a food. And I think that the other part of that is educating yourself about these products and being able to identify these products, being able to read, the labels and understanding those. I think part of it also is communication. So like you might say, well, I'm not going to have this in my house. I'm not, that's not going to be in my house. But, what about, if your kids go to someone else's house, a friend's house or
right, sure,
a family member or maybe a family member or friends or somebody brings it and they have it in their purse and they bring it to your house. So a kind of that sort of open communication to everyone that your kids are around or that you're around to be like, this stuff is pretty potent. It's pretty dangerous if a kid gets into it. So, I just want to make sure that if you have it, that it's not available to small kids.
Definitely.
And also knowing about our phone number. Like I said, the Poison Center phone number is 1-800-222-1222. And we never close. We're always open. We're always available to help with any of these types of questions. Even if you're not sure if somebody got into something, you can always call. Our specialists are trained to be able to kind of walk through the situation and be able to tell you, what would be recommended. So those are definitely the things that in terms of like what can you do for parents of small children,
Yeah.
or teachers or anybody that's around small children? Those are kind of the things to maybe think about. I think the other population is the teenagers. And I think personally, telling them directly, what the risks are and educating them directly on, these types of products, and that it's not just marijuana, that it's, that there's concerns. And I think part of that is that perceived risk or lack of risk, that can happen, especially with the teenagers, and adults in some situations, and really kind of letting them know that, like, this is something that is highly potent. It can cause significant symptoms. Um,
I think that's
and
one of the big problems, don't you think, with legalizing it is then the perception of harm. Oh, my mom or my dad does this. It can't be bad, and it is bad. But
And I think it's a particular problem with marijuana. I mean, I think probably because of that major shift and
yeah,
change in just marijuana in general,
yeah,
that's probably the reason why it's that perceived risk is so much less,
hmm
than maybe, cocaine or heroin or fentanyl or something like that. But yeah, and I think that's almost in some situations like more concerning sometimes, because it's like, if you really don't think it's a big deal, then you're probably more likely to try it. And particularly
right.
if it's a peer pressure situation or,
hmm
um, another type of situation. So that's also kind of like the messaging to teenagers is sort of deciding on your personal limits, when it
hmm
comes to using it. Decide, like, is this something that you're willing to try, or how can you say this isn't for you and that you don't want to use it. Also, I mentioned, like, we get calls from our patients are every age, but our callers can be every age too. So you don't have to be 18 to call the poison center. I mean, anybody can call. And if you're worried about something, if they have questions about something, anyone can call us. And so that also is something that we'd love to let people know, that that's a
Right.
resource that's available. And I think there's also some situations where most of the time with our teenagers, a lot of times the ingestions are intentional, like they're,
Sure.
intentionally,
Right.
wanting to take the THC
hmm
edible. But in some situations, it's unintentional, it's
Right.
accidental. Maybe the friend does give them candy or whatever, and they don't tell them that it has
No.
THC. And so it can kind of be both, with the teenage group. But I think knowing about the products and the differences, in the products and the resources that are available are really important for that group. Um, and I think as a community, it's important, to know about these products and what can happen, when somebody gets these products and what they look like and what's out there, and be able to kind of talk to the kids about it and say, like, this is something that I'm concerned about, and kind of making a plan for what to do if that situation comes up, with using.
And I think it's always good to ask them what they think or what they know,
Mhm.
and just sort of open a dialogue. It doesn't have to be just say no, you just want to find out
Right.
what's going on and what they know and see what you can interject. But I think the community awareness is so important. That's what we do with Step Up. We keep going out there trying to do more and more so that people can understand what is going on before we lose a life. We don't want to lose a life, any
Yeah,
life.
absolutely. And I think the other thing that I didn't mention in the teenage group is the whole, and this is a whole nother, whole nother podcast, but the driving piece of it, right?
Oh
And
yeah,
the teenagers and potentially driving under the
Mhm.
influence and things like that. And so that's a whole nother, part of the conversation, I think, particularly with the teens,
Absolutely.
in terms of race
Absolutely.
and
Well,
knowing.
this has just been amazing. Honestly, Alicia, you are awesome, as I already knew that. And I just really am so grateful that you would be on today, but getting this information for this amazing resource, because it can be used, like you said, for anybody. And I also had heard that some of the older people, I'm in that group probably, that, but not taking gummies, but think that that's going to help them with their arthritis or whatever. And I'm not saying it does or doesn't, CBD, I don't know, but have gotten problems with mixing medications and stuff. So they can call too. It doesn't matter. Right.
Absolutely. Yeah. So that's one of the things that I mentioned is like, you don't have to actually have an exposure or be poisoned to something to call us. So
Right.
sometimes people do call, they get a new medication and they want to know what the side effects are, or
Sure.
would interact with their other medicine.
Mm-hmm.
Those are types of questions that we can answer as well. So actually, yeah, any age.
It's just such a great resource. I've known it from the beginning, but of course it's evolved and it's even better than it was. So, yeah, I think this is awesome. I appreciate this information. So anybody that wants to share this, we would be so grateful. It can be shared on the social media platforms. It can be shared on LinkedIn. That is one. It could also be shared on Spotify if you want to just listen to it. And it's on YouTube. And also it is archived on my website, which is www.stepupanderson.org. And all our newsletters are on there as well, with so many different topics that you would most be interested in. So, Alicia, thank you again. This was wonderful, absolutely wonderful. And I really appreciate you doing this.
Oh, you're very welcome. And thanks for inviting me to be on here. And I appreciate all that you guys are doing as well. And yeah, for the audience, feel free to call the Poison Center anytime. It's 800-222-1222. Or our website is ohiopoisoncenters.org.
Thank you. You have a great weekend.
Take care. You too.
Bye-bye. Thank you all for being here today and taking the time out of your busy, busy schedule to listen and educate yourself. Our children are our most prized possessions, and they're not our possessions, that's for sure, but people in our lives, and everything we can do to try to save them is so important. So thank you, and please share this, as I said, on the different social media, Spotify, YouTube, so that we can educate more and more parents and caregivers. Thank you so much.